Hello, and welcome to Beyond the Surface. The Healthcare Services Institute was founded 9 years ago to examine a frequently overlooked foundational factor in the spread of HAIs. Over these years, we've gained valuable insight and effectively highlighted how surfaces and products can support and harbor microbes, along with the challenges healthcare professionals have encountered when attempting to clean and disinfect them. I'm Linda Liebert, the Executive Director of Healthcare Services Institute. On our podcast, we will interview healthcare experts, patients, thought leaders, researchers, and many others about the challenges we face in our ongoing battle to mitigate the spread of microbes that cause HAIs and solutions that are being introduced. I'd like to welcome Iris Verdi, who is the Director of Strategic Accounts for Healthcare at KBS and brings over 25 years of experience in environmental services leadership and hospital operations. She serves as an ISSA state advocacy leader for Delaware and sits on multiple national committees focused on healthcare, cleanliness, compliance, and sustainability. And she is also a member of our brand new healthcare platform. She is one of our advisory council members. Welcome, Iris.
Thank you so much for inviting me.
So, you have been in this for many, many years in a variety of different positions. And what I'd like to talk with you about today is there's been a lot of changes in healthcare and a lot of challenges, no doubt, especially when it comes to environmental services or what we call environmental hygiene. And could you share with me a little bit about the changes and really what has been your biggest challenge? And more changes are happening now. I'd like to know, what are your challenges right now as well?
So I think the biggest changes have been investing in education and compliance. So when I started close to 30 years ago, um, it was more cleaning than disinfection, I think. There was more of the make sure the floors are shiny, make sure things look good. But there wasn't the same focus of ensuring that your surfaces were clean and properly disinfected. There wasn't the same investment in training. And I think over the last 10 years with HAIs being a huge focus, COVID coming to the scene, there's been much more of a focus on really making the investment in training and ensuring that you have the proper protocols in place, that you're validating that your surfaces and your rooms are being properly turned over. I think the biggest challenge is still working with the time is money factor, especially when you're working directly in a hospital. So you still have that push of patient flow and turning over rooms quickly. And especially in an OR setting, you'll have a doctor who's standing outside that room while staff is trying to do between case cleaning, and you have that push pull. So I would say that that's always been part of the problem, and that remains the number one problem.
If you could make a change in that area, what would it be?
I think being able to demonstrate, and I think I've successfully done that in a lot of the hospitals that I've worked with, to the physicians that this is not a safe place for your patients. We want to avoid readmissions. You don't want surgical site infections, and you have to allow us to do our job just like we allow you to do yours. Communication, education, and also enabling your hourly staff who are in there the ability to speak for themselves and say, wait a minute, you can't come in here. I need to complete this room. And sometimes that empowerment just makes a difference.
I had the pleasure of being a participant in a workshop that ISSA will be offering here very soon. And I spoke about the surfaces, and in particular, I have a photograph of an operating room. And I put the photograph up of immediately following a difficult case and what it looked like. And these were all nurses that were in the room, and one of them immediately raised her hand. And in this particular facility, their job performance includes time in and time out. So getting that patient in the room, getting that patient out of the room. And she was very forward with talking about the fact that she knows those rooms were not safe for the next patient. So, what do you think the steps are to help empower environmental services professionals as well as others to be able to make some changes in this area?
I think you have to keep the conversation going, and I think you need to invite the doctors to the table and nursing staff. And I think nursing is a great advocate for ensuring patient safety. They always have been. The physicians need to come to the table and meet with the EVS leaders and talk to the housekeepers about how challenging it is to try to turn over rooms when somebody's pushing them out. And it extends past the ORs. We know that when you have a full ED, they're pushing for those rooms to be turned over quickly. And if you're dealing with, especially in the wintertime, so we went through the whole quademic this winter, right? So you had COVID, you had flu, you had RSV, and then let's throw in some norovirus for fun. So you have these inpatients who require terminal cleaning, and the ED is at capacity, and everybody's standing there asking for these rooms to be cleaned quicker. And there has to, again, be a timeout and saying, no, we have to do this right.
Mhm.
And communication is key, and being able to sit with your leadership and express how important it is to do things the right way. We're not going to shortcut handing out meds. We're not going to shortcut treating a patient's wounds. So why would we shortcut cleaning?
Well, and obviously everybody wants to have a clean room and a safe
What?
room, knowing that you have to go in. Um, so it sounds like communication is key and communication with the staff. One of the things that help me understand is EVS professionals are not always in an ED area at all times, which is part of the problem.
100%.
I will never forget the day I was having a conversation with the director of nursing at a children's hospital in the ED. She was the director of nursing in ED. And she looked at me and she says, Linda, during cold and flu season, our nurses are being pushed to get people in and out. And that's part of the Accountable Care Act as well. So it's more, there's some regulatory components to this that are an issue. But she said, you know what we do? She said, the nurse will go in, wipe down the railings of the gurney, flip the sheet over, and get the next patient in. How do we begin to have that conversation and really talk about the importance of cleaning and disinfection? Is it a team of people that need to sit down with senior leadership or C-suite professionals? And where do we begin those kinds of discussions?
Well, it's funny. I was thinking about this last night in preparation for our conversation today, and you see how healthcare facilities are making investments in infrastructure, right? They're spending millions and millions of dollars on expanding their EDs, putting standalone EDs, really trying to create better healthcare solutions for the communities that they serve. But then they're not making the investment in maintaining that infrastructure. And the ED is a perfect example. So you have a housekeeper who's assigned, usually one, to a large emergency room, and their function is cleaning the waiting room, taking care of possibly isolation patients, maybe going into the trauma bays, but really maintaining the nurses' stations, pulling the trash, and taking care of the bathrooms. Then you have the ED techs who are running labs, doing basic blood pressure, taking whatever, and they're the ones who are turning over the rooms. 90% of the time, they're not even being trained by the EVS staff. So you have someone who has absolutely no basic understanding of cleaning and disinfection, who's turning over your most critical rooms of between patients who are most likely infectious. And EVS is only coming in, and we all know that this is true, maybe touching those rooms once a day, even though there's been 25 patients in that room. And that is a huge barrier. I mean, from my LinkedIn posts that I was an inpatient recently, and I had a horrible experience. And it was relating entirely to the three different rooms that I was placed in during, a 48-hour period.
Uh-huh. So tell us a little bit about that. What was your, those of us that have experience in this industry, it is a very difficult situation when you are suddenly the patient. So
Right.
can you tell me a little bit about your experience and what you
Absolutely.
saw?
So, I was unfortunately severely dehydrated, and I was brought to the emergency room against my will by my husband. And uh, It's a great hospital system with a fantastic reputation that I know recently has made a multi-million dollar investment in infrastructure, which is why my experience was so disappointing. Um, didn't didn't spend a lot of time in the waiting room, which I was grateful for, but was immediately placed into a hallway bed uh, with a stretcher that was clearly not clean. And I am a complete germaphobe. It is absolutely no, uh, it's not a mystery how I ended up in this profession. I have that mix of germophobia and OCD that makes me really good at my job.
Yeah.
And as we were leaving the house, I grabbed one of my throw blankets and wrapped myself in it so that nothing would touch my skin. I just completely wrapped up in my own blanket. Um, but you can tell, just especially when you're in this business, if a surface has been cleaned. And I was sick and I absolutely didn't feel good, but I was looking around the room. There was a privacy curtain next to me that I could see clearly that had blood on it. There were spots on the floor. I had to go to the restroom. The restroom stunk. And then I noticed the housekeeper. And I'm watching this man, by the way, for 2 full shifts. So he was there through the day shift and the evening shift, trying to do the best that he could. He had no janitor's cart with him. So he was only using the PDI wipes that were in the room to basic cleaning. I didn't see him touch an overbed table. I saw him wiping down the headrail, the handrails on the stretcher, but he's using a tiny little PDI wipe to wipe down the bed, throwing a sheet on, never changed his gloves between the cleaning task and placing the clean linen, just the little things. And I'm I'm dehydrated. I'm in and out of pain, but I'm excuse me. And my husband at one point actually went to go to the bathroom and heard the nurses at the nurses station, and they thought I was a surveyor because I kept saying, "Excuse me, privacy
Yeah.
curtain's too short. Excuse me, you're not supposed to have that sharp container in here." I went into radiology, and I couldn't take my protective blanket with me, and I said to the lovely technician, "You're going to have to wipe that down in front of me before I'm going to sit on it." So,
Yeah.
uh, hand washing was pretty much non-existent.
Yeah.
And so the nurses realized that I was an EVS director eventually and started talking to me and started actually sharing their frustrations with me and saying how often they clean and how working in an atmosphere where they felt their leadership didn't care enough to provide adequate cleaning made them feel that their department wasn't important. And what I really found fascinating, so I made a LinkedIn post. I obviously have no interest in blowing somebody up. I don't want to shame another hospital,
Right.
but I posted a picture um, of the room and I removed all identifiers. So it didn't show what hospital system it was. And 2 nurses from that hospital reached out to me and recognized the room and shared their opinions and thanked me. But the one thing that really stood out is both of them said that they never saw leadership rounding in their area. And one of my favorite saying is you can't expect what you do not inspect. So if we're not walking through our facilities and we're not looking to see that they're appropriately cleaned and we're not talking to our janitorial staff and our nurses, we're doing a disservice to our patient. And it's not just not making the investment in having enough housekeepers or doing the training. There's so much that happens on the backside of not cleaning appropriately, right? You have readmissions, you have hospital acquired infections, your infrastructure is not being properly maintained. If we're not cleaning properly, your bed surfaces, your equipment is not going to last. So
Yeah.
you're actually losing money by not making that investment. And I recognize how hard, during the pandemic, I was an EVS director. I operated at a 33% deficit for almost the entire pandemic. I cleaned the ICU almost every day for probably several months. We all had to make decisions. We stopped cleaning offices. We reduced our public areas. We did what we could. a lot of hospitals have chosen to start outsourcing either their hospitals or their satellite locations. I made the decision to leave working in a hospital and coming to work for a building services contractor because I wanted to bring that level of expertise. And I was excited to work for a company that wanted to make that investment. But one of the other things that I'm seeing is that they're still looking for that lowest bid instead of looking for the partner with expertise. And that's not doing you any favors either. So just because someone's coming in and providing you with a pretty shiny floor, which by the way doesn't belong in a healthcare facility anymore anyway, because it's dangerous, you need that person who has an infection prevention program, who has the policies and procedures to back up what you need. You need someone who wants to sit down with your infection preventionist as a partner and say, what are your goals for your cleaning programs? And we have to do two things. We have to say to our building services contractors who want to play in this field, you need to be educated and you can't just come in and guess. It's important that you understand the regulatory compliance, and it's critical that you understand that if you don't do this right, you're hurting people. But on the flip side of that, we need to have the people who are making the investment in outsourcing, which is becoming more and more prevalent, to choose partners who have that level of experience, not the cheapest, the best, because you're investing in your patients and your community.
Well, and as you said, the infrastructure,
Yes.
the damage.
We're maintaining your assets. We're representing your community. And when we bring in, it's funny, I had a conversation yesterday with one of my executives, and I said, when we're working in a healthcare system, I'm here in California for a big startup. When we're working in a healthcare system, we're hiring people who are a part of that community. And the most important thing that we can do when training that hourly staff is say, this is where you live. When you're cleaning, you should be cleaning as if the next person in that bed is someone you love, because I've had that.
Yeah.
I've been that family member. My ex-husband years ago was severely burned in an accident, and they brought him to my emergency room, to my burn unit. And I had that moment of saying, do I trust my staff? And the answer was yes. And he spent a month in the hospital and he never got an infection because my staff was properly trained.
Yeah. Yeah. So important. Uh, one of the other things I talk about, you've mentioned infrastructure many times, is the fact that our healthcare facilities are not built for cleaning and disinfection. And I, obviously, being a surfaces safety expert, one of the things that 2 years ago, I went around and I did 37 different architectural presentations. And one of my first questions was, how many of you read instructions for use and the care and maintenance documents before you specify a product? I
And
would
now with Joint Commission, that's no longer something maybe you want to do. That's something you have to do.
right. And it is really, really fascinating to watch all of this stuff transpire, because it is not, um, as I go into these areas that have to be turned over quickly and frequently, I often do not see them built in a way that will be safe for the patient coming in the next time. And for, when you've got these room turnover time requirements, it's very, very difficult to turn a room over if it's not conducive to effectively turning it over. And
Absolutely.
and that happens a lot. So it's really frustrating to me, as you said, that we aren't cleaning and disinfection should be number one, top of mind, and it is not. And so it's really frustrating when we talk to people like you, and then you as a patient having that patient experience, the dangers of that environment. And so, it's so telling.
Yep.
So some of the things that we're going to do with ISSA and our new healthcare platform is do a couple of these workshops where we'll go in to a facility and we'll open the doors of communication between all of these areas. And I'm so grateful that you are leading that effort as one of our advisors. So that is really exciting for that. So anything else you want to add here today?
I think that it's so critical that the messaging is out there that this is an this is a field that requires investment, whether it's investing in your internal team, investing in your partners. It requires continuous education. It requires partnership with all of the departments. It's not just nursing and physicians. You want to partner with patient transport. You want to ensure. So one thing that I always did as an EVS director was go to the head of the ED and say, can I please train your staff? I am happy to do that. I will come in on all 3 shifts and teach your techs how to clean and help you build your competencies. Same thing with the operating room. Most of the time, it's equipment techs who are cleaning between cases. Let me help you and make sure that we're cleaning to the right standards.
Right.
Having as many conversations as possible is critical, with Epic or teletracking or all the different systems that are out there for trending and patient flow. Everyone's looking at how fast patients are getting from the ER into a bed. And they're looking at, oh, your housekeeper took an hour before they responded to this room. But are we looking at those reports to say, oh, your housekeeper took 7 minutes to clean that room?
Yeah, exactly. So important. So important. Well, Iris, I am so grateful to have you part of our organization and be working side by side with you.
Thank you. I'm excited to be a part of this. And I've been excited since the day I sent you an email saying, hi, I would like to be your new friend.
Yes, it's been such an honor. And I'm so grateful that you joined us today to share a lot of your experiences. As I mentioned, I know we'll see you again in the future. And with that, I will thank you and see you soon.
Thank you so much for having me today.
You bet. Hey, I wanted our listeners to know that the ISSA healthcare platform has launched. On the website, you will find all kinds of things, blogs, resources, training information, workshops. Stop by our website. It's issa.com/healthcare. Thank you for listening to Beyond the Surface. This podcast is brought to you by ISSA, the Worldwide Cleaning and Facility Solutions Association. Please subscribe and write a review for us on whatever platform you enjoyed this podcast on. For more information, go to healthcaresurfacesinstitute.org.